COVID-19 is because of coronavirus. The coronavirus is considered as a public health emergency. What do you mean by a public health emergency is that the preventive strategies should be leading than the treatment strategies. That's a simple understanding of it as a public health emergency. But people have to understand, now when you have the word emergency, you think it comes and goes like tsunami, and then you have the rehabilitation strategies in place. But unfortunately, this virus to be eliminated by inventing a vaccine. And according to the global situation, that vaccine will take time. So therefore, this is a kind of emergency which will last for a while, possibly 1 year life. So because of that, we have to handle this emergency for a longer period. The second major issue here is it's a global challenge. So because of that, if it had only affected our country, we should have saved us and we should have got the help from the other parts of the world. But as you know, this is a global challenge. Every country, whether they are poor or rich, whether they are powerful or not, all are affected. So therefore, because it is a global challenge, it has become much more complicated than any of the viruses during the past. Since year 2000, there had been 6 global emergencies declared by the WHO, the World Health Organization. And when you see those 6, now some of the diseases like bird flu had a death rate of about 40%. And even the MERS, SARS, death rates are higher than the coronavirus or the COVID-19. But unfortunately, COVID-19 has its highest rate of spread. So it's dangerous because it has a very high ability to spread than the mortality. Mortality is around, or the death rate is around 2 to 4%. Now, it is not a death rate is not applicable all over. There are highly vulnerable groups. Like if you are very old, you are vulnerable. And if your immunity is suppressed due to various reasons, like if you have diabetes, hypertension and those diseases. So you can see if we have a non-communicable disease, you have higher prone to get COVID complications or death. So therefore, we have to get together and fight against this disease by understanding the disease, all these features. Now when you are going to understand the features, now I would like to show this chart. Now this disease has a very high R0 value. What do you mean by R0 is that when you have one patient affected, if it is given to 2 people, you call it R0 more than 1, because it will then what will happen is in time there will be lot of people affected when you have one patient. Now according to the COVID-19 Chinese information or literature, what they say is one person within 30 days can spread to 512 people within 30 days. So that kind of a highly, with a very high ability to spread is a problem here. So therefore you have to bring strategies by understanding that situation. But if the disease is spread from one person to one person, then the R0 is only 1, then that will remain in the society for a while, but that will not be a big challenge for us. But what we have to try is, we have to make sure that one person will spread to less than one person. Then only you can shrink the disease out of it. The second important fact here is the COVID-19 danger is that when you have this disease, unlike SARS where you had about 100% symptomatic, all the infected people had symptoms, so therefore you will be able to identify them. But in COVID, 20% will have no symptoms, we call them asymptomatic, and another 60% will have very mild symptoms. So the tendency for them to come to the hospitals or to consider that you are ill is lesser in this disease. So therefore, what you can see is this disease is hiding in the community or the society. That is the one important factor when you are going to deal with this COVID-19. The second issue is, now the next option is to test these patients to see whether you have the disease. Now, when you are going to test the disease, you call a parameter called sensitivity. Sensitivity means if you find 100 infected patients who can disseminate the disease and who are having the disease, if you test on these 100 people, COVID by PCR, that is polymerase chain reaction test, can only detect 70. So active disease patients with about another 30 are missed out by the disease. That is what you call by sensitivity. So because of that, you can see disease is hiding in the society in one way, and when you are going to use the test to diagnose these patients also, we can't confirm the patients 100%, we can only confirm about 70, so we are missing about 30%. So that is also another reason why handling of disease has become difficult. But at the same time, what people should realize is this disease is not originating from the country itself. It should come from outside. So therefore, if you control the portal of entry of the disease, like the airport and the other portals, we will be able to understand where this disease is getting entered into the country. Then once you enter only, it will get disseminated all over. So therefore, we have to have a mechanism where you have to detect the patients first, and then we have to detect the contacts. So this is how it had to organize your thoughts. But however, when you take the full picture into effect, we call it the entire country, what they have realized is this disease, once it starts spreading, we have to do all the activities very fast to bring it down. They have used the word hammer. Yeah, you have to hammer with the hammer. So then when you bring it down, people think that you will be able to eliminate or eradicate the disease. But that will only happen once you get the vaccine. So until such time, we will have then and there coming up, there will be small level of fluctuation. So they have called it the dance. So therefore the hammer and dance theory is that. So once we control it, we will come to the dance phase. So therefore, everybody should take responsibility and work with alertness to handle this situation. That is why now the working out strategy at the moment is to limit all the activities and limit what they have proposed is therefore what are the strategies that we can combat or handle this disease. Now one thing is to limit the movements. Now what the expectation, if you don't limit the movements, if you leave it as it is, this disease, one person will be able to spread to 512 people within 30 days. So it is highly spreading disease. And what the government did was to bring this hammer zone, to bring it under control, they applied a movement control under the context of curfew. But curfew compared to the other curfews, it's different. So the expected movement control was about 80% or more. Why I say that? By this movement control, if you just control for about 70% movements, what will happen is, what they have observed is that will control, but there will be a second wave coming up. So therefore the expectation is to control their movements to 80% or more, ideally to 90%. Now how are you going to achieve this 80% movement limitation? Was if you have 5 people at home, you allow only one person who is not old to move out and bring their essentials to their house. So other 4 are at home, and this person also, when they go, that person goes out and comes back, he will have to ensure that he will not bring corona back home. So therefore, when he is mobilizing himself outside home for the safety of the rest of their other members and for himself, what we have to do is we have to have social distancing, because this virus, when somebody coughs, it can go up to 2 meters, but if they don't cough, if they wear a mask, that will not go beyond 1 meter. So if you maintain your 1 meter distance, you will be safe. And the other important thing is, surface like this virus can stay or live for about 3 days. So because to limit that, so if a person comes after 3 days and he touches this table, that person will get infected. So to avoid that, the hygienic practices where you wash your hands well And when you go home, you take your all clothes out and wash yourself and go home, and then you ensure that this you have not though you have gone out of home, you are not bringing corona back home. So, and this is what was expected. Now once you do that, we think that we have done this hammer phase and we have got control. But that doesn't mean by releasing the or lifting the curfew, releasing and allowing people to mobilize themselves to move, doesn't mean that you will be able to get the 100% movement rate. So there should be some restraining abilities in order to, or limitation of their movements, and you have to move for your all essentials. Because when you are closing a country for social or health reasons, there are two other aspects will affect, that is the economy and the social reasons. So we have to handle those also. So taking those things into account, now we have to allow certain amount of mobility. That doesn't mean that the responsibility lies on the government, responsibility lies on the health and other teams, and very importantly, the responsibility lies on the part of the public is being eliminated. So everyone is responsible to look after themselves and their families and the society. So if we all work together, we will be able to handle this COVID-19 situation. Now, the second phase what I want to tell is, since you are school children, now how you are going to handle this situation. Obviously, you are in your student days, so you should learn. So there is no harm. You do studies at home, you do some physical activities, play at home, and do some home gardening. You get involved in the home activities, like you can clean your rooms, clean the house, clean the garden, and you can go and work with your father to learn about your organizing skills, and you can clean his vehicles, you can help him doing his whatever the farming and other things, and you can help your mother cooking, doing home arrangements. Those learnings are possible at this point, and you will understand that that will not spread the COVID out of range. And at the same time, you have to study. Now, how you are going to organize your studies? Now, we have seen sometimes there are a lot of online teaching, TV-based teaching, so they use various types of technology to teach you. But at the same time, we have to understand the fact when you are confined to house, you will have stress. Now, how we are going to handle your stress is another important thing. Very important thing, you can play, you can do physical activities, and you can use music. You have your music instruments at home, you can sing songs, you can work together, and that will definitely improve yourself. And another very important thing, doing religious activities. I am a Buddhist, so I can only talk about Buddhist, but you can have the corresponding things for other religions as well. Like saying, doing your all looking after all the flowers, and you use to pluck flowers, and then you can chant Pirit. And we have seen chanting Pirit has a very important impact on improving your immunity and your mental ability. We have found a lot of literature from various other parts of the country or world that how Pirit is going to help you. Even when you are in the mother's tummy, baby who is supposed to born, there are studies chanting Pirit has a benefit to the babies who are yet to be born and still in their mother's pregnancy. And once they are born, when you play Pirit, they are not only the intelligence, their ability to look after their immunity. There is a boost on immunity is proven. Not only that, when you are a little bit older, you can start meditation, mindfulness. Those have proven benefits. Now, American Cardiac Association, Stroke Association, all this medical expertise have suggested, or they are using as an intervention, asking people to do. Earlier they actually proposed this mindfulness, but now they are very clearly suggesting that meditation will be helpful. So we had done some research in Colombo district on school children, and what actually happened was, when we asked them to meditate for 10 minutes, a short duration per day for one term, the next term results has gone up in every subject, including English language. So therefore what you can do is, As I told you, you can do your studies, you can play and mobilize yourself for exercises and play items. Then you can help your mother, father doing their activities. You can do home cleaning and home activities. You can do gardening and other activities. Then you can get involved in your kitchen and other activities involved. Plus you can do music, and also you can do religious activities like chanting Grata and chanting Pirit, and then doing mindfulness and meditation. They will definitely benefit you to keep yourself better than what it was. Every crisis is an opportunity. There is a saying. So therefore, this crisis should be used for the benefit of all of us to improve ourselves. People thought that globalization will be helpful all the time. People thought that importing all the food and other items are going to be the only way to improve our country. Today it has proven that we have to look after ourselves from all angles, individual point of view, and also as a family and as a village and as society. So this is a very important positive opportunity that given us to be with our families, with our parents. So you have to take maximum use of that. Especially you can ask your mother to teach you how to cook, how to keep your house well, how to look after you, how to relate with the other outsiders, all these things. So that will be a scholarship for you. Especially you can ask the organizing skills, how you organize your economy and other things, home economy, we call it microeconomy, all these things by your father, his organizing and other skills, how he is looking after his all activities, how he time manage, all these things can be learned from your father. So this is a good opportunity to learn how to run a house, a home. And more than that, this is a very positive opportunity where you will be able to use this opportunity to learn about home gardening, how to keep your home tidy and clean. By analyzing the COVID, there are a lot of positive aspects. The positive note is, one thing is, as school children, you didn't have opportunity to spend your time with your parents. This is ideal opportunity. You are with your parents. So therefore, learn everything from your parents. Like say, your mother will be able to teach you how to keep your house tidy and clean, and how to cook meals, and what are the ways and means of identifying good food. Like say, how we are going to identify the best cereals, how we are going to identify your vegetables, fruits, and then all the spices. All these things are medicine, and how you can mobilize yourself to work in the kitchen to cook yourself, and see how you can use all this food to improve your immunity. That is a good opportunity for you to use. Then from your father, how he is managing his time, how he is managing his economy, how he is using his organizing skills, how he is managing with others, how he is relating with the other relatives, then their neighborhood and their office staff, and with the society. All these things you will be able to learn at this opportunity. This is a very good opportunity to learn all these things. And another important thing is, you will be able to play as a family. You can play carom or some physical activity, and those things will definitely improve your unity, and home environment you can optimize that. More than that, you will be able to learn about the importance of your religious activities, your merits, and those things are very important. So you can get together and chant Pirit, you can get together and do meditation. You might be able to talk about things you had long delays in talking. You would have been kept on postponing certain discussions to be taken at home, can be done here. You will be able to share your stress, and you will be able to share your difficulties with your parents and your other brothers and sisters. This is a very important positive note. And not only that, this period can be used to plan yourself for next year, next 10 years, and all this can be done during this time. So I think this is every crisis is an opportunity. So therefore, this crisis had to be taken as an opportunity for you to improve yourself from all angles, as I mentioned, from what you can, the scholarship. Now, when you are given a scholarship, always people mean that it is a financial thing. But now, suppose if I give you an example, suppose if you want to become an air pilot, and if I give you 2000 rupees per month versus I give you a chance to meet a pilot at a place where he is doing piloting. So what is more important, with the 2000 rupees or the experience with the pilot? Or if you want to be an entrepreneur, I will get an opportunity for you to be with the entrepreneur for a couple of days. What is more important? Like that, when you become bigger, when you become adults, what will happen is we have to learn not only the subject or the school education knowledge, but also how you are going to live as a family, how you are going to relate with your relatives, how you are going to be with your neighborhood, and how you are going to work as a team in the office. All these things are, we call them soft skills or lateral skills, are so important. They were dying during the past because we only focus towards our exams, our education. This is a time for you to improve your holistic attitude, holistic attributes to improve yourself in long run. So this crisis is an opportunity from that angle. So therefore, while safeguarding yourself and the family and the society from COVID-19, if you take it as a positive note to improve yourself and how to face this kind of challenges and crises, that will be the best opportunity given by COVID-19. We have to take it from that angle for the best interest of yourself and your family and the society in whole. Thank you very much.